Would you trust your loved one's safety to outdated tech and guesswork? In today's episode, you'll discover how cutting-edge patient safety systems are revolutionizing senior living and how one simple installation mistake could cost you everything. Let's dive in.
Welcome to From Leads to Leases, a CCR Growth podcast that helps senior living providers transform their complex challenges into opportunities. Listen in for stories from industry leaders, innovative strategies, and insights. And with our expertise, learn how to increase occupancy faster, guaranteed.
Welcome back to another episode of From Leads to Leases, the podcast that dives deep into the senior living and senior care industries, bringing you insights, strategies, and stories from the experts at the forefront of marketing and sales. I'm your host, Jerry Vinci, CEO of CCR Growth. For those of you who don't know about us, CCR Growth is a full-service marketing and growth agency exclusive to the senior living industry. And at our core, we help providers achieve three things. Number one, we deliver higher qualified leads that convert to tours and move-ins in less time. Two, we help reduce or remove the reliance on paid referrals, significantly reducing your cost per move-in. And three, we measure, optimize, align, and integrate all your marketing and sales systems to track crucial data like acquisition costs or the length of your sales cycle, helping your communities make more informed decisions that positively impact growth, sustainability, and profitability. So through this podcast, I'm here to guide you through the evolving landscape of the senior living industry, helping communities connect with the families and residents they serve in more meaningful and effective ways that impact your bottom line. So today, we're joined by Glenn Rappaport, CEO of CCI Health Technologies, a company providing innovative patient safety solutions to healthcare and senior living facilities. Glenn brings a wealth of experience, having spent over a decade managing healthcare facilities before transitioning into the health tech space. His deep knowledge of facility operations, patient safety, and vendor relationships gives him a unique perspective on what communities truly need to create safer and more efficient environments for both residents and staff. So in this episode, we're going to dive into a lot, but most importantly, we're going to dive into patient safety technology, the evolving landscape of facility management, and how senior living operators can improve their relationships with vendors to ensure the best outcomes. So Glenn, welcome to the show. I'm super excited to have you here.
Oh, thank you very much. I'm glad to be here. Happy to participate and looking forward to the discussion.
Yeah, me too. So you've had a long career in senior living before transitioning into the healthcare technology space. So can you share what led you from running healthcare facilities to becoming the CEO of a patient safety technology company?
Yeah, I mean, I ran a lot of different types of buildings and assisted livings and adult daycare centers. And my wife, actually, after we had our second child, said, there must be something else that you could do with your knowledge and your relationships where maybe we see you a little bit more. We love you and we'd love to spend more time with you. And I made some contacts and I called people that I know from the industry and I ended up calling CCI and he needed somebody to come in and run operations. And I said, you know what, let's try to go on the other side for a little bit, see how it works out. And here I am 8.5 years later and we've been working out great.
That's great. How does that past experience in facility management shape the way you approach patient safety today?
Basically, when someone calls me for information and I'm advising them either in person or over the phone, I try to understand what the needs of the community is versus what a sales directive would kind of try to throw at them, right? So you want to really understand from the core side, what type of facility they have, what are they looking to do, what their budget is, and then I can better advise them on the options that they might have.
Okay. And can you talk a little bit more about what CCI offers? Like what's the full scope of services that you typically put together for your clients?
So CCI Systems is been around since 2003. We're the leading provider of nurse call systems in New York, New Jersey. We've grown to other states as well at this point. But we do nurse call, whether it be a wired system or a wireless system. We do wandering prevention systems for people that have dementia. We do access control systems. We do IP camera systems. So basically, patient monitoring systems in facilities, whether they be hospitals, nursing homes, and assisted living. But we specialize in the healthcare sectors only. So we're not putting cameras in people's homes.
Yeah, tech has definitely come a long way. So yeah. So obviously safety is a top priority in senior living, and I think providers in general struggle with implementing effective systems. What do you think are the biggest gaps you see in current patient safety practices, and how does technology help fill those gaps?
Well, the AI is coming out. There's a lot of new advances in technology, a lot more wireless devices, notifications now through applications on people's devices, whether it be a tablet or a phone, is very common in today's practices compared to what used to be. So you're able to maintain better oversight of the clients that you're servicing. So I would say that those are the main changes as far as new interfaces with new platforms to what they're used to have back in the days.
Yeah. What do you think providers should be looking for when choosing a safety system today?
I would suggest that definitely find references of somebody that has that technology in their building and how they're using it, how their services from the provider that put that system in. Because there's a lot of great systems out there that just aren't installed properly by the installer, which could ruin your experience with that type of technology. So that's always key. And make sure that you understand all the functions of the system, right? A lot of times people can put in the system and there's a lot of capabilities, but they don't use all the capabilities. So, make sure that you understand everything that it can offer. Every community is going to use their system differently, of course, because there's different populations, but understand what it is that you're buying, what it can do for you, and just make sure that the company that's going to come in and service it and install it is going to be there for you throughout the lifetime of the system, right? And you also want to know how long the longevity of that system is, right? Because there's a lot of systems on the market that they're going to discontinue within, let's say, 3 to 5 years, and the newer system came out, and I see this happen all the time. And someone will buy a system that's been around for 15 years because the technology is it's been around for 15 years, it's great, but they don't realize that those parts are going to be discontinued in three, right? So now
Yeah.
you just made this investment on the system. Great, it's wonderful. You got great references on it, but you didn't know because no one told you that the manufacturer is going to discontinue that product line in 3 years. And now you're back to square one. So definitely
Yeah.
make sure that you understand all the components, not just the usage of it, but the longevity of them and who's putting it in, their reputation. And, really just make sure that you know what you're getting yourself into before making a large purchase.
Well, I think that's a really good point. I didn't even think about the installer being a factor, right? Making sure that the person who's doing the work actually understands of how the system is supposed to work, because the system in itself is just a tool, but then how it's being implemented is just as important. So somebody could have a really bad experience with something that actually works really well. But if it's not installed properly, it's not going to do its job. So that's definitely a good point.
Yeah.
What advice would you have for communities weighing the cost versus the benefits? Because I know many senior providers, they hesitate to invest in new technology because of cost. Everybody's got this, they all have a tight budget, and squeezing anything new out of it sometimes can be difficult. So what would you say in terms of weighing the cost versus the benefits of upgrading their patient safety systems?
I would say make sure that you're buying something that's going to, like I said earlier, sustain the longevity of the building, right? That's key, because cost at that point is irrelevant if in 3 years you're going to be back to square one, right? So make sure that you're not putting money in front of money. I would also say try to find out the full cost of the system once it's in. For instance, if you're buying a system that's wireless and it's utilizing batteries, understanding that over the 15 years of that system, there's going to be additional costs. Where if maybe you're buying a wired system that might be a little more expensive up front, over that course of 15 years, you're saving the money on other avenues that you think you're saving. And I see that happen all the time. So you look at all the avenues of the full cost of the system, not just the initial purchase price. It's like buying a car, right? You buy a car, okay, I bought a Toyota or I bought a Mercedes. Okay, the initial hit of the Mercedes is there, right? Versus the Toyota. But some people don't realize now you're getting the maintenance on that car, and you didn't realize that the oil change is $500 versus the synthetic $90, So in our minds, we think that all the costs associated with buying a system. So make sure that you really do your research on that before making the purchase. It's like going shopping, right? You have your wants and your needs. So you need X, Y, and Z in your system. I have to have those things, and then you have your wants. If you can get some of those wants into it, that's always a great thing. But make sure you get your need taken care of initially, because then you're going to be, you know, not taken care of and get back to square one.
I think the car analogy makes a lot of sense for me. We have an electric vehicle and it's almost 3 years old now. And even since we bought it, the battery life, the range on the car has started to go down. So now we have range anxiety every time we go on a longer trip. We're like, is it really going to make it that far, or are we going to have to plan, multiple stops to charge along the way? So that there again, that's an added cost and now a frustration and headache every time we want to travel. So we have to factor that in. So I think that's important if people are looking at installing a wired versus wireless system. Just shifting gears to talking about running healthcare facilities, since you have so much experience in that space too. From your perspective now, I mean, being able to step away from the industry in that sense and into this new space, and now looking at the healthcare side from a different perspective, I mean, what do you think are the biggest operational challenges that healthcare facilities, especially senior living, they're facing today compared to when you were managing communities?
I would say there's a lot of changes from when I was doing it, 9 years ago. The smaller communities, right, that are 5-bedded or 10-bedded, they're really struggling, right, because the reimbursement rates for a lot of them are getting paid through SSI reimbursements and things like that, and obviously they don't have the capital to invest in this technology that we're talking about, because their margin is so small in how they operate. And you're seeing, in my opinion, a lot of these smaller facilities, or even facilities in general, being bought up by larger groups, right? So the larger groups are swallowing up the smaller ones. Some are still working independently of one another, but as a whole, New York-based companies are moving out to mid-states and so forth, and buying more properties to manage and run. Everyone's trying to work within their realm, so working better with the hospital systems, the nursing homes, and the assisted living to try to reduce readmissions, right? There's programs like DSRIP that you can get reimbursements, right, for not allowing patients to return back to hospitals. So those things have changed over time. And management, people are looking at facilities differently as well, in my opinion. Everyone's trying to save the buck, because it's harder to buy everything today because of everything's expensive. Look at the price of eggs, right? The price of everything has gone up. I remember running my building, and the price of tomatoes at that point, that was the big thing, was tomatoes. And it was like, a case of tomatoes is that much. And you almost like, I think we have to move away from the tomatoes.
No more tomatoes. No.
No, tomatoes in the salad. We're just gonna have make it Caesar salad, right? No tomatoes, but people are always looking operationally to get the cheaper cup, to get not just in patient safety, but in general, right? Operations in general. You're looking like you're running your household, right? It's no different. The skilled facilities, the assisted living facilities, the adult daycare facilities, they're all looking in how am I getting reimbursed, right? How are we going to manage moving forward? Because everybody wants increases, right? The minimum wage rates are always going up. And in assisted living, it's not like in fast food or in the supermarket where you can put a kiosk and people could self-service themselves. Okay, I'm going to have someone give me a bath. I'm going to press that. I need somebody medication. Okay. So those types of things aren't really in the market. So, your operation is not going to change. But it's funny, I did see something about several years ago, these med management devices that people are using in independent living, where you load this machine, and
Yeah.
at the medication time dispenses it automatically to the patient, which saves that FTE of someone having to go around. But then you still need someone to go around to check to make sure that that person actually took that medication.
Yeah.
So it's just maneuvering. So I think those types of changes. I think how they're sending out the DALs, right? The changes in regulatory stuff is constantly changing, that people need to make sure that they stay, focused on, because the regs are the regs, right? But then people don't always look at their dear administrator letters and don't realize that regulation changed. Like for instance, you're not supposed to have a delayed egress maglock in front of another delayed egress maglock, right? It's just not when you're supposed to have, even if they're both connected to the fire alarm system. So, but those regs are constantly changing in the different states. So I would say if if you have these regulatory changes, make sure that you stay on top of them, because they are changing. And then there's always that mix where, oh wait, that's a fire code regulation, and this is a Department of Health code regulation, and sometimes they conflict.
With the boom in the population of older adults now, I just think there's this cultural shift in terms of the mindset around senior living in general, where even my parents in their mid 70s are like, I don't want to go live with a bunch of old people, Okay, you could say that, but I do believe stage over age, so they're not at a stage yet where they see themselves needing to live in a community like that. But I think there's just a shift in general around the concept of community. I think a lot of people don't see themselves in community like previous generations have. So we're seeing a lot more like micro communities pop up now. Do you think with the influx of, obviously there's way more older adults coming into the market now, how do you think we handle that influx? I mean, is our micro communities the solution? Is that a simpler, more effective option operationally, or are we going to need to build bigger, more expansive facilities to accommodate everyone?
I think it's multifold, right? I think you're going to see small community centers instead of these big hospitals. As you see, most surgeries are in and out same day now, right? People are not staying in hospitals, the
That's true.
reimbursements and so forth. I think you're going to have a lot of telemedicine in your home, right? A lot of more home health care. You see like the MLTCs working with family members, getting reimbursed to take care of their loved ones. You're going to see a lot more of that. I think you will see more of these smaller based community houses that are converted into senior living in populated areas for those baby boomers, because there's just not enough facilities, right? And there won't be built in time to handle the baby booming population, which is kind of funny because as I had mentioned to you when we first talked, these facilities started off in California with people expanding off of their homes, right? Before regulatory regulations even existed. And it's kind of like going backwards in time, because everything repeats itself to, yeah, they are creating these homes that take 3 to 5 residents, in Florida, in Arizona, in these, populated areas. So it's kind of funny how things go back to where things start. But I think that though a lot more is going to be with telemedicine. People do want to live healthier, younger, longer. They want to stay in their own homes. So I see that also as an issue, because there aren't enough caregivers to take care of that baby booming population. So there's going to be a lot of career growth for people that want to go into nursing and home health aid and that type of career. It's definitely going to be a need in the next 10 to 15 years.
I feel like staffing is kind of at the core of everything right now, because there's one provider that I've been speaking with. They have 35 communities. And I asked them about future growth. What are your plans down the road? Are you looking to expand and everything? Because most of their communities are pretty much at max occupancy, and so they're doing well. Clearly the money's there to grow and develop if they want to. But they basically said because of where they're located that they just can't. They don't have staff. They can't find enough staff to even staff a new building. So they're just like, I don't know. If we get into another market where we acquire other communities that are already established, there really isn't room for them to scale. So that's probably the number one challenge, I think. And because it's not just senior living, right? It's hospitals, it's doctors' offices, it's the entire healthcare system in general has a lack of nurses and doctors and caregivers to fill those slots. It's challenging.
It's definitely a challenge.
Yeah.
And one that's going to have to be overcome, because you can't just leave people unattended, right?
Yeah.
So there's going to have to be solutions out there. But like I said, I think with the telemedicine and, the home health aides and that sort of thing. And again, I love the fact that, these companies offer the ability to have a family member take care of their loved one and get reimbursed through that insurance plan. I think it's a win-win, especially with people with dementia. You know, they're afraid to take any help as it is. But if at least if it's their daughter or their son, they have a comfort level with them, they're going to get the care that they
Yeah.
need. As
Familiar
long as there's a
surroundings.
checks
Yeah.
and balance system, right? You want to make sure that people are not just saying, "Oh, I'm taking care of my mom, give me some money," because there's always ways that people take advantage of a system. But I think those are good things for people to have the ability to have if they wish.
Yeah. Well, I think, again, a lot of providers, they're focusing on census growth, but they're overlooking the operational efficiency to get there, that they don't see the connection. How do you think better safety and tech integrations actually improve the resident experience and retention rates?
Well, with the technology today, with two-way audio communication through the residents' rooms, through, let's say, a nurse call system, it gives them a sense of, I know that somebody knows that I need help, so they're not panicking, right? Everybody today wants instant gratification, no matter what it is that we're offering, right? They want to know, I want my food and I want it delivered and I want Grubhub to bring it to me in 5 minutes, right? Or I want the drones in the future to just bring it to my house and like the Jetsons, you want the food to come out hot after I push the button. So technology, if the staff are getting the technology to know that somebody needs their help, and the patient knows that they have a person coming to them, that there's an awareness that they need help and somebody's coming. There's systems today that can send a notification right to the desk and then to an app, and then that app, one of the staff can say, "I got it," right? So that sends a message out to the other four nurses that Sally's taking care of Josephine, and if she doesn't respond in a period of time that the community sets up, it sends out that notification again, right? So technology in that way will definitely help improve the standards of what the patient or a resident can expect, and the staff response times. Staff response times can also be in a lot of systems monitored, right? So you know where your peak times of service is and where your down times are. So maybe you need to put an extra staff on the 7 to 3 shift, and then the overnight shift, maybe you don't need as many people, right? So you can maximize your staff efficiency patterns to better, give better quality care and service to the client that you serve. So I think technology definitely helps assist with those things. Even the systems today have a lot of connections to better TV channels, right? Back when I was running buildings, we had senior TV or cable vision or whatever. But today, everybody they want to be able to watch all their sports, right? Their specialty shows that they were watching at their house, and now they come here and they don't have that, and now they feel like they're missing something in their life,
Yeah.
right? Oh no, I can't watch the 4th season of that series, and what am I going to do? I'm going to have to stream it on my phone, and so things like that. And then you're also seeing some technology coming out in the nursing homes. There are robots that are basically, they come in, they can do vital signs, they can actually do even interpretations if somebody speaks a different language, right? So you're seeing those types of technologies being integrated. I see them in a lot of the nursing homes that we're doing.
I do also like what you're saying about data, how it kind of travels through. Having all these systems in place allows that data to pass from one person to the next seamlessly without there having to be this delay in transfer of information or knowledge about the patient's status or how they're doing or what needs to happen next. They can just look and see what's been accomplished and what's still outstanding. So that's really cool. I know we kind of talked a little bit about the installation process and how important that is, but are there other red flags that providers should look for when vetting vendors to ensure they're getting long-term value rather than just a product?
So I would say your experience with a vendor when they first coming in will kind of also display what you can expect through the process, right? So if you have somebody come in and it takes them a week to get you a quote, right? You can expect that it's going to probably take them, a while to do the job, right? Or again, that's why I tell you to vet the person very well, because a lot of times, and I know from being in that other seat, I put a system in, they're all so friendly and nice in the beginning, and then you have a problem and they're nowhere to be found. And that's the problem, right? When you're dealing with patient safety systems, life systems, you don't have time to wait for that, right? You want to make sure that the company that you're dealing with, that you have direct access to the people that you need to reach and that they're always available 24/7, right? That they have a technician on call in the case of an emergency or the state's in your building. You need that response time. Maybe they can give you some troubleshooting over the phone, even if they can't get there on the same day. The way CCI works, we try to partner with companies and let them understand that we're there for the long haul, right? It's a family, right? We want to be there in the beginning, the middle, and the end. As you need us, we're there for you. You know, hopefully you don't need a lot of service because we did a great install. But in the event that you need something, you're going to be able to get somebody on the phone. I love helping people, right? I love the fact that I know that I'm guiding the people in the right direction, whether they want to go with a different system or not, because it's better for them. That's fine. So find the right solution for your property and just make sure that you vet the company very well, right? Because the worst thing you can do is spend money, no matter how much it is, and then feel like you've been taken. Understand that the references, that you're calling, make sure that you ask them all those questions. How was your experience with the install? Not just on the product. When did they install it? Do you have issues? How many times do you have to call them within the first year of installation, right?
What was the onboarding?
When you had a problem,
like?
how long did it take for someone to call you back or to resolve the problem? Again, because it's not just the technology, it's the installer of that technology, right? It's very important that the person that installs your system, you have a comfort level with, that you do your homework and you check the references, and then you get that good feeling. And there is going to be a learning curve, right, for your staff and for yourself to understand how to use everything. So make sure that the company that's going to put it in is willing to in-service your team on how to use it.
That's
and there's
huge.
always going to be that change of staff, right? So a year later, your director of nursing is no longer there. Who's going to train that person, right? Or administrator left, and they were the ones that knew how to use the system. So make sure that the company is willing to provide you that ongoing service on all sides, not just for when something breaks, but I need someone to educate me on how does this recorder work, or how does this app work, or how does this maglock, how can I get around it if it's alarming and it's the middle of the night and it's driving everyone crazy, right? So those are the things I would say to people that are going to make an investment in a new system and look for a company to do it. Cheap is not always the best, and the most expensive is not always the best, right?
Yeah, that's great advice. I think too, when you're talking about referrals as well, I think you can look at it that way, because even if somebody has great referrals, is the referral source a similar setup to what you need, right? Because the product might work perfectly in one type of building, but that might not directly reflect your specific case, so you need to be extra careful with that. I mean, obviously there's life is on the line with these types of services, so it's crucial that you get it right. So that's a big challenge for sure.
Have your staff involvement, right?
Yeah.
I see a lot of times one person will make the decision for the whole community without consulting with the people that are going to be using that system. So like if you're doing a nurse call system, I would definitely recommend get your director of nursing involved, ask your aides, what is the current system doing for you now? What would be your wants, right? Because again, ask them what you would want. Ask your staff, like, what are you doing now? What would make your job easier? What would make it easier on the patient or the resident of the property, right? And then also people hold systems till they're in crisis mode. I see that all the time. So I would advise your listeners, don't wait till you're in the X. The system is dead. It doesn't work, and I need it in right away. Don't wait for that time. Also, have your maintenance team check the system, right? Because a lot of times you can find that something's not working sooner than you find it out. So when they're doing their water temperature checks, like you have to do, they should check the nurse call in that room. I used to have my maintenance team when they go around. Water temperature logs, fire extinguisher, nurse call, right? Always check your systems when you're doing your spot checks. Why not checking your system? You're going to check it once a year. You're going to do a full system check once a year. That's too late. That's too late. Now you have a problem. How long has that bell not been working for that patient? God forbid they have an emergency. This is your lifeline. This is a way for them to call and say, hey, I need help. Help me. Oh, the cord was wrapped around the bed and it got squashed in the bed and there's a short and it didn't work. Well, how long has that been going on? I don't know. I just found it. It's been 6 months.
Yeah.
Golly, God forbid, fell off the bed. And that's when you see people screaming in the room, I need help, I need help. Yeah, that's not good when you're giving a tour, Hey, what's
No,
going on in that
that
room?
that does not look good at all. And then, I mean, patient safety technology is not a nice to have; it's a must have. So
Yes.
doing those
Yeah.
quality checks is super important. And I think that's a way to kind of streamline and optimize that whole process, where people see it as one more thing they have to invest in. But if you integrate it in with everything else you're already doing, it's adding value across the board. I think it's also, peace of mind for the family members who
Right.
put their loved one into the community. Now they know that there's these safety checks in place, so there's value on both sides of it.
Yes. Exactly.
If you were giving advice to, say, a new executive director or operations manager today, I mean, what are the three key things you think you would tell them about prioritizing patient safety in their community?
I would tell you, make sure that all systems are go, right? Always make
Yeah.
sure that the maintenance team is checking your systems. I would tell them to make sure you understand all the functions of the systems that you have in place. Um, and that staff are properly trained on those systems would probably be the three that I would really tell them is, again, make sure everything's working, make sure that you know how to use them, and make sure your staff is trained on how to use them as well. Um, and also what to do in the event that something isn't working, right? There's, evacuation plans and everything that people have in place, but, people use the tap bells and people do 2-hour spot checks, and there's the regulatory stuff that's involved. But some things you have to go off the cusp, right? And that's not enough, right? 2-hour spot checks too long in certain places, right? So just make sure that they have things in place. Make sure that the residents are comfortable when situations like that happen. And look at your building as a whole, right? Because again, I've ran so many different types of buildings that what I did in one building isn't the right in the other building. So look at your scope, look at your staff, look at the whole picture, and then say, what can I do if there is something that's not in place, right? You need to protect the resident. That's no question. How you going to do it, and look at it from that scale. I always tell my team, if you're not part of the solution, you're part of the problem, right?
Yeah,
So your
it's
team
true.
together collectively need to come up with a solution, because the answer is there is none. That can't be the answer.
Yeah. Have you seen that there's things communities could do that would help open up the budget towards more of these types of solutions?
The only thing I could really say about that is some communities will charge for, let's say, a dependent piece of a nurse call system, right? So let's say I'm putting in a new system. I don't have the capital to do the whole thing, so I have to be creative. So I'm going to say, okay, we're offering pendants now to patients. There's a monthly fee of $10 to $15. Now you have some income coming in that you can use to pay the bills with. So that could help with that patient safety device. So in that avenue, you can maybe do it like that. The problem, like I said, depending on the size of the property, if you have a building that's very small, that's small margin, right? And the systems aren't as expensive as the bigger ones. However, the brain of a system is still needed in every system, and those are typically the most expensive components. Tell me when there is ever enough money in the budget for anything, but I would say charge for pendants in the event you're getting a wireless system with pendants in assisted living. But again, try to work with companies that might have some sort of payment plan that will work with you. Have borrow money, with the bank, put it on a 0%, interest credit card for, 20 months and pay it off that way. There's a lot of ways you can be creative, I guess. Always budget for the things that you see are coming down the pipe, so that you're not just hit all at once, and expect that one unexpected, right? Make sure that the references are right. And like you said, if you're comparing two quotes, make sure that they're apples for apples. This one gives me audio. This one gives me pendants. This one gives me lights. This one gives me an app on my phone, right? So make sure that you know all the things that you're getting with a system, and not just, so those are definitely, things that you should look into before making any type of
Yeah.
major changes.
I I love that too. The idea of scaling as you go, starting small with like just dependents, for example, and then moving into a larger and more robust system over time as you start to like generate some additional revenue through those types of services. That makes a lot of sense. So lastly, Glenn, how can our audience stay connected with you and learn more about the work you're doing at CCI?
You can always follow me on LinkedIn, how we met. It's always a great avenue, and people can always send me a message. I'll be more than happy to help them in any way I can. They can follow us at CCI healthtech.com, or they can call us at our office at 718-438-0819. At the end of the day, I will always be honest and try to help people the best I can. I think it's important that people are getting the right product for them and not necessarily just the products that we offer. If I could help them in any way, that's really what gives me, like I said, I enjoy getting up every day and doing the things that I do because I used to do what they do. I can have a better appreciation for what it is
For
that
sure.
they need and try to give them a little sound advice. And if they go with a different system, that's fine too. I'm happy. As long as it works for you, I'm happy. I really am. And I'm just happy when people get the right product for their community versus hearing the horror stories afterwards. Those are the worst.
Yeah, no, I think it's really valuable that you have that perspective of both sides of the industry now, so you can really put yourself in someone else's shoes and what they might be going through when they're making that decision-making process in terms of what system to install or what their needs are and everything. So I'll make sure we put all your links in the show notes and everything. As we wrap up today's episode, I want to extend a huge thank you to Glenn Rappaport for joining us and sharing his expertise on patient safety, healthcare technology, and facility management. Glenn's deep understanding of both operations and technology makes him an invaluable resource for senior living providers looking to improve safety and efficiency. If you want to stay connected with Glenn and learn more about CCI Health Technologies, visit ccihealthtech.com and check out his LinkedIn profile. And again, we'll include those in the show notes. As always, we hope you found this episode insightful and inspiring. Don't forget to subscribe to our podcast on your favorite platform and stay tuned for more episodes where we continue to explore the dynamic world of senior living marketing and sales. And also remember that From Leads to Leases isn't just an audio podcast, it's a video podcast. So if you want to see the video versions of our episodes like this one here with Glenn, make sure to subscribe to our YouTube or our Spotify channels. I'm Jerry Vinci, CEO of CCR Growth. Thank you for joining us on From Leads to Leases. I'm truly grateful for your time and attention. Until next time, lead with strategy and with heart. Chat with you again soon. Thanks, Glenn.
Thank you so much for having me.
Thanks for listening to From Leads to Leases. Are you ready to fill your rooms faster and increase occupancy? Visit ccrgrowth.com to learn about our Senior Growth Innovation Suite, a proven system to generate highly qualified, tour-ready leads, accelerate sales, and reduce acquisition costs. Let's connect and turn your challenges into opportunities. See you next time.